Hello again, everyone. Welcome to our COVID-19 community briefing, 8th edition. And my name is Marty Guthmiller, and I'm the CEO of Orange City Area Health System. I have as a guest today Dr. Meis, our pediatrician, and we'll talk to Megan in just a little bit about what's going on in her life these days. And so what I want to start today with is right off the bat, give you our scoreboard that we've been sharing every day. And we've done a total of 54 tests now for COVID-19, and we've had 3 positives. So again, not a positive test here now about 10 days approximately. So 3 positive, 51 negatives, and there are no pending tests currently. And so I think we'll just jump into interrogation of Dr. Meeks at this point. So welcome, Dr. Meeks. Glad you're here today. Could you just give us a little bit of background on who you are, where you came from, and all that kind of stuff?
Yeah, definitely. So I'm pretty close to the area. I grew up in Mars, Iowa, so not too far away, and I still have a lot of family there, so it's kind of nice to be close to home. I started here in August as the first general pediatrician, so that just means that I see patients from the time that they're born up until they're about 18, through 18 until they turn 19. So I've been having lots of patients come establish care with me, and it's nice to be a part of the community and get to know some of the families around here. So
great. Yeah, you've been a great addition for us, and we're very fortunate to have Dr. Meis here. The practice of pediatrics is really a primary care practice generally. Is it any different in a rural setting like Orange City when you have family practice docs who care for all ranges of ages with people? So is it a little bit different for you in a rural practice?
Yeah, it is a little bit different here. Not a lot of small towns have pediatricians. So in some senses, I'm a little bit more like a specialist. I certainly see any sort of general care for the younger population, the children, but sometimes with certain cases like specifically ADHD or things that the family providers may not see as often, then I can help provide that bridging care where I see that a lot more often in my day-to-day practice, and it may save a referral or a trip somewhere else if it's something that I see more of. So
great, thanks. Well, let's shift to the topic of the day, coronavirus, a little bit. Now, one of the things that we've talked about as a medical staff, and I'm sure as a community, is that we are so fortunate that by and large the virus has not severely impacted kids. That we know that age 60 and above, it gets hit much harder. But kids are not immune to the disease by any stretch of the imagination. But yet, the kids are impacted by it, certainly because of what's going on around them, right? I mean, no school, being at home, having to tolerate mom and dad a lot more, that kind of thing. And so one of the things we wanted to talk about a little bit is you could offer any guidance at all towards keeping our kids healthy during this time, whether that be hygiene or diet, those kinds of things. So could you talk a little bit about that?
Yeah, definitely. So I think a lot of parents are finding that they're spending more time with their kids and schools are out, and even some daycare facilities are not, watching the kids, and just with people working from home more often, that there's a lot more kind of exposure time. And certainly the biggest recommendation as far as keeping kids occupied and busy would be to still have a good schedule. Just because they're at home doesn't mean they should be sleeping in till noon or anything like that. We recommend trying to keep them on a schedule as much as possible. In general, kids do better when they're a little bit more structured. So, waking them up, having breakfast, getting dressed, kind of having still somewhat of a schedule that you're following as far as, staying healthy and safe. I think everybody's well aware of the recommendations to, wash your hands frequently, especially before going out into the public settings or when you come back from public settings, making sure you're covering up any coughs. If anybody is sick or not feeling well, it's good to do that social distancing and stay away and just kind of wait until everybody's feeling better and healthy, to try to minimize the spread of germs as much as possible. So that's kind of, I guess, the main recommendations that I'd have at this point.
Do we have any recommendations on kids wearing masks?
Yeah.
Anything you can share with that?
Yeah, and those recommendations have kind of been changing over time. You know, originally we said masks are more reserved for the people as a protection, where if you're feeling sick, you should be wearing a mask just to prevent your germs from being spread to other people. More recently, they've kind of come out with, well, maybe people can be asymptomatic, the germs can be spread even just from talking or more mild close contact things. So they have gone to saying masks would be recommended for when you're out in public, or even in our well clinic. I know that we're wearing masks to just kind of protect any spread that could be going on. For kids specifically, I've seen some recommendations of, you know, children under 2, not necessarily recommended for them to wear masks, just because obviously, you know, we worry about the mask fitting properly and making sure they can breathe properly. I think certainly ages 2 and up or 3 and up, it's okay for them to wear masks, assuming you have the proper size. I know there's a lot of videos out there with how to make the proper size mask, or making your own mask at home. You know, kids may not always understand why they need to wear masks. So I think depending on the age level of your child, it'd be helpful to kind of talk through why they're wearing it. They may not be super excited to wear it.
Right. We don't want to scare them.
Yeah, definitely.
Do you have any suggestions or recommendations on screen time?
Yeah, screen time. You know, in general, the American Academy of Pediatrics recommends trying to limit any, you know, recreational screen time to 2 hours or less per day. So I know that that's tricky when everybody's, you know, stuck at home and there's not a whole lot else to do, but certainly trying to think of other activities to keep kids busy. Hopefully this weekend the weather will be nicer and people can maybe get some more outside time. I know they have limitations on the parks, but even just, you know, kind of going out to your own backyard or doing like nature hunts, looking for leaves or sticks, or, you know, kids can have a lot of imagination and a lot of fun just doing things even in their own backyard.
There might be a few Easter eggs out there somewhere yet.
Yes.
You never know, right?
That's true.
Okay. Well, another message is, and a way to introduce Dr. Meis is she's still here. She's still seeing patients, obviously, as are our other family practitioners. And so we'd like to thank Dr. Meis for joining us today. And she has to endure the rest of this video as well. So don't go anywhere, because you never know, there might be another question that comes up. Yeah. But one of the things I want to continue with masks is a little bit is to encourage the continuance of mask making in our community. If you'd like to make masks, we would gladly accept those. Again, we feel we have a current adequate supply of PPE, but we want to continue the judicious accumulation of supplies just in case we need them. So if there's some question out there on whether or not the health system would accept masks, we will. We clearly would encourage that. And thank you for the masks that have been made by the hundreds at this point. I'd like to shift gears just a little bit in terms of some things you might have heard in the region, and that involves the outbreak that's currently happening in Sioux Falls, and more specifically the Smithfield plant. I think the last I heard was over 400 at the plant were infected, and that has some cross infection issues perhaps with JBS and Worthington. And so we're keeping a real close eye on that. The number of positives has dramatically spiked in Sioux Falls, as have the hospitalizations, both at Avera and at Sanford. Again, not in terrible numbers. I think the last number that I was told was 24 inpatients at Avera and 7 at Sanford. So, but with the number of infections being determined now, that number could go up. So we're keeping a close eye on that as well. We will not be broadcasting or doing a video tomorrow. And so I thought it might be helpful if you're concerned at all or interested about what's going on in Sioux Falls or Iowa or Nebraska or Minnesota. The site that we've been recommending to do that is IHME, which again is University of Washington and the Bill Gates Foundation. And that can be found at healthdata.org, healthdata.org. And you can keep an eye by state, I think even by county, as to what's going on. And it's in some cases reassuring, in some cases just informative, but particularly over the weekend, you can do that if you'd like. On that subject, we continue to advise you to stay connected. There's various sources like Community Health Partners, CHP, that's out there. Our website, OCHealthSystem.org, is there with lots of references to IDPH and CDC. I would encourage you to continue to look at those sites for information to the extent that you want to the extent that you find healthy. But again, adults need to limit their screen time too, right?
Yes.
Yeah. Be careful what you inundate yourselves with. And again, Dr. Meis mentioned being outside this weekend. I intend to be, and I always bring up and smile a little bit because I think our lawns and our landscaping this year is going to look the best ever because we have lots of time to pay attention to that. I'm going to really change gears here now a little bit because I think it's appropriate that some of you are aware that our board chair, Randy Jacobsma, is critically ill at this point. He's in Sanford in Sioux Falls. And I'm not sharing anything out of school here at all. There's a Caring Bridge site for Randy right now that you can look at and stay up to date with what's going on with him. Again, this is influenza A and I believe B, it says on the site, but not COVID. I know personally Randy's been tested at least twice for negative or for COVID and has been negative. So this is an influenza issue, but he is critically ill. And on behalf of the family, I am asking for prayers on Randy's behalf and for his family during this very difficult time. He's in as good a spot as he can be. They are caring for him as well as he can be cared for at this point. But please keep him, Melinda, and their family in your prayers. Again, our next briefing will be Monday, and we've mentioned a couple times, it looks like a great weekend. Have a great weekend. Get outside. Remember to keep your social distancing, to be practicing those measures daily, hourly, by the minute. And please stay vigilant, stay strong, and stay healthy. Thank you again for joining us.